Are surgical masks effective?
Actually, not really.
Hi, I'm Dr. Michael Lum, pediatrician at One Love Pediatrics, and this is my wife, Dr. Amanda Del Rosario, pediatrician at American Medical Center.
And we're going to be sharing with you today some useful information and the latest updates on the novel coronavirus outbreak.
Coronavirus is the name of a family of viruses that can infect both humans and animals. Before this new coronavirus, there were 6 known coronaviruses. Some cause the common cold, while others can cause more severe respiratory illnesses like SARS. It's unclear how severe this new coronavirus will be, but there are currently about 20,000 confirmed cases and a little over 400 deaths so far, for a mortality rate of about 2%. As of right now, there are no confirmed cases on Guam.
The new coronavirus is believed to have spread from an animal source, with the outbreak initially detected in Wuhan, China in December 2019. Investigations into the exact way that the virus is spread is still ongoing, but similar to a cold or flu virus, it's likely spread through respiratory droplets from coughing or sneezing. It's also possible that it could be spread when a person touches a contaminated surface or object that has the virus on it and then touches his or her mouth, nose, or eyes. Symptoms of 2019 nCoV include fever, cough, and shortness of breath. Some people may have very mild or no symptoms, while others can become seriously ill with severe complications including pneumonia. So if you were in China within the past 14 days and feel sick with fever, cough, or difficulty breathing, you should definitely go see your doctor. Try to call ahead first to let them know of your symptoms and recent travel so they can give you further instructions on how to minimize potential exposure to others while waiting to be seen.
Like most viruses, there is no specific antiviral medication, nor is there a vaccine currently available. Treatment is supportive, meaning that people infected with 2019 nCoV get treated for their symptoms, but there is no specific cure. The best way to prevent infection is to avoid being exposed to this virus. Before we go on to the final question, I'm going to ask Dr. Amanda some questions that's been coming up on social media. Are surgical masks effective?
Actually, not really. So surgical masks are not designed to keep out viral particles, and while wearing one may provide some protection, it actually works more effectively for the sick person to wear the mask to prevent spreading illness to others.
Okay. Are there any myths going around in social media?
Yes, so if you happen to get sick with a fever and cough, it does not necessarily mean that you've been infected with coronavirus and are going to get really sick or die. Remember that it's still currently flu season and there are still a lot of flu and other cold viruses going around. So if you have a fever and cough but have not recently traveled to China, it's really much more likely that you have a cold or the flu and not 2019 nCoV.
Is it safe to travel?
The situation's still evolving, but at this time, the CDC recommends avoiding all non-essential travel to China. Traveling to places without confirmed cases of 2019 nCoV is probably still fine, but just remember to take the proper precautions for preventing infection.
If someone works in the tourism industry, should they be concerned?
Well, I'd say similar to if you work in the healthcare fields, the same precautions would still apply.
Are there any activities that we should stop doing at this time?
Well, first of all, if you yourself are sick, you should stay home and avoid interacting with other people. Other than that, just try to avoid close contact with people who are sick and remember not to touch your face with unwashed hands. And lastly, as pediatricians, we recommend not taking babies and young children out to crowded or public places. And this would also apply to the elderly and anyone with medical conditions that can weaken their immune system and make them more vulnerable to infection.
Okay, moving on to our last question.
So a few simple everyday actions that can help prevent infection by coronavirus and other respiratory viruses include avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth with unwashed hands, and washing your hands often and thoroughly with soap and water, or if that's not available, then use an alcohol-based hand sanitizer. It's also a good idea to regularly disinfect frequently touched objects and surfaces that could be contaminated, including your phone.